So we all have two hemispheres of the brain, unless we've had some sort of surgery. But the left side of brain is our learning side. It's the auditory side. It's our short-term memory. So when we learn information, it comes into that left side of the brain. And then fairly quickly, information should pass through that midline of the brain, which is called the corpus callosum, into the automatic memory, the long-term memory. So sometimes that corpus callosum, though, is acting as a barrier instead of a bridge for information, or sometimes even a mirror. So a lot of you may have children who things are reversed for them. But thankfully, back in about the 60s, Drs. Stoneman and Delicato found out that if you move the body across the midline, you can actually make connections across the midline of the brain, so information will pass easier. So really, that's the brain integration therapy that we teach. Really, is just 20 minutes of exercises you do in your home with your child to make connections between the two sides of the brain, just doing physical exercises.
So what may be some indicators for parents if a child has this issue? What will they be seeing their child struggling with?
That's a really good question. So most of the time there are processing issues. Visual processing may be difficult because not just information has a difficult time passing that corpus callosum, but also processing will be. So many of our children are behind in reading because information isn't crossing easily,
Right.
also
Okay.
because their eyes aren't tracking well.
Mm-hmm.
Many of them struggle with writing, the actual act of writing. We talk a lot about smart kids who hate to write. And then that auditory processing where you feel like you're teaching a child something, sometimes it even seems like they really get it, and then they lose it. And you're starting over again. That's a very clear sign that that corpus callosum isn't doing its job. Do you want to add anything to that specifically?
Yeah, I think it's interesting that it's difficult sometimes to think about how the body and the brain are so connected.
Right.
But there's even physical things that we see, right? Like the difficulty with tying our shoes or skipping. Maybe they gallop, they stay on one side, but they don't skip, right? Because that's bringing those two sides together. So there's lots of little also physical things that we're looking for that show that really brain wants to stay homolateral. So it wants to work on the one side. It doesn't want to integrate. So that's where we get really nerdy, is because there's so many things, that are really aha moments. For me personally, it's like, oh, wow, all of these physical things related to that learning issue, just that we are so connected.
Yeah. Yeah. And the brain's fascinating. So we have some kids who struggle with all of the areas and physically too. Then we have some that are real athletes. So physically everything came together, but they still have a hard time getting thoughts. You give them a you think that you're killing them, to put a pencil in their hand. So,
Right. And then it could be that they whatever sport they're doing is very, one-sided as
it
well.
can be, and we really do find it's really handy sometimes because for our kids who do care about athletics, you can talk them into doing the exercises more easily when they know that it's going to
That's
improve
true.
their game because it really does.
Right.
It gives them a better sense of where they are in space. So